Good evening, beautiful people. How are you guys doing this evening? I hope you guys are doing well. Thank you for joining us this evening. This evening, we got such a beautiful topic. And Teona is a returning guest, and she's going to help us to understand the role of recruiting physicians. Because many times we see physicians, but we really don't know what goes on behind the scenes. We don't know that they're burnt out. We don't know that they're stressed out. We don't know that they're facing challenges because they put on such a good smile on their face when you walk into the office. They put on such a good smile on their faces. But behind the scenes, they are just like you and I, and they go through so much of stuff. But I'm going to leave the stuff for Tiona to tell us the stuff. We just want to welcome you this evening and please share us out. If you know someone who can benefit from this podcast this evening, just share us out. And don't forget to subscribe to Soul Light and Body, that you will never miss none of these episodes. I'm Karen Pascal, holistic health and wellness coach, and a co-author of two books with my sister, Joan, Self Care is Intentional and Your Gut and You. And they both are available on Amazon. You can pick up yourself a copy, or you can gift someone because the holidays are coming up, and you can send someone a gift and use this because this is going to be able to help them on their journey in life. I'll now hand the mic over to Joan. Tiona, welcome once again.
Good evening.
Wow, what a what a treat to have you with us and bringing such a beauty of enlightenment and all the good stuff. But today the question is to everyone: where are you at a junction in this moment? November is almost moving through so quickly. Where are you? And what is standing in your way from you moving to that goal that you're trying to reach to? What is standing in the way? Take a second look. Think about it. Sit with it. Are you practicing self care? Are you nourishing yourself, putting quality food in your body? But nourishing yourself is not the only thing. You got to nurture. That's why we focus on the 12 components because eating the great food, which is very nutritious for our body needs that. But what about the other part of our makeup, our relationship, our finances, our environment? We create a post today which we talk about decluttering, especially now the holiday season is emerging on us. How are we navigating through that? It's time to make a level of clearance. It's to unload. Gift what you're not using and make that clearance in your life. Gift what is out into your environment and cleanse what is inside the internal. What are you not letting go? Because in order for us to grow and really reap all the beauty that life has to give us, gotta let go some things. You gotta let go so you can live a fulfilled life. You want that fullness. We want to walk in our level of excellence. And how do we get that? How do we achieve that? We gotta let go of things that don't serve us well. We gotta let go of things that don't serve us well. So that we can move in a level of alignment. We can move in a level of clarity. And we can move with a clear intention. Be intentional how we move. Gotta set those boundaries. Those are so much important for us, for our well-being. Because in order for us to live life and feel fulfilled and move in a level of alignment, we got to make sure the essentials are in order so we can walk in our level of excellence. We can walk with our grace. We can walk with our power that when we show up in a space, we can come with that level of power. What are you showing up today with when you walk into a room? Or what are you leaving? What are your deposits that you're leaving in the room after you walk away from there? What value you bring into the space that someone can have a great takeaway? Tonight we got a great program for you, great show. Just sit back, relax. Thanks to all of you that support us on this journey and listen to our podcast both on Soul Light and Body and Enrichment Mind, Body and Soul. Because there are great tips there. There are a lot of gems that drop that you can expand your toolbox. So thank you all. And tonight we have such an amazing guest. My name is Joan Williams, holistic health and wellness coach. And so we got such a great show, and she's such a special person, amazing person. Because all our guests that come through here are amazing. They're unique and they're special. Yeah, we can say that. So, Teona, welcome back. Thank you for being here again with us, and thank you for all that you do in creating such a great value and impact in the world. And tonight, you got a great topic for us tonight, physician recruiter. So, we're going to hand the mic over to you. Thank you for being here.
Joan and Karen, thank you so much. I was humbled the first time you asked me to come on. I was even more humble the second time, and to get a third invite back is just absolutely unbelievable. So I'm grateful and humbled, and I'm really fortunate to be here in this space with you guys again, with all of your viewers and your listeners. So I hope that tonight the information is really helpful. I hope that we have doctors and healthcare providers that tune in tonight, because so much of what you said in your opening, Joan, I have to say that we're here to talk about physician recruiting, but one of the things that I hope everybody, in particular, if there's physicians that are on the call tonight, joining in here about balance, about setting boundaries, about taking care of your well-being, because the very first thing I'll start out with is that our healthcare providers, we are roughly 4 years out of the pandemic right now. And what we knew before was that healthcare providers tend to have burnout. Post-pandemic, we're really seeing that hit. So I hope that for all of our healthcare providers out there, that you really are taking care of yourselves, because we have to have healthy providers in order to have healthy communities. The healthier you are is a healthcare worker, the healthier, the more you can pour into your patients. And it really does start with everybody being an individual who is healthy. We do our jobs better, we take care of our families better, we show up better in all spaces, and that holds true for physicians as well.
Wow. That is a great way to kick off, because as you all of us as human beings, regardless whatever sector we're in, whichever part of life that we are, whichever part our career is in, we have to be well. In order to bring productivity and value, wellness is important. Our well-being is important, because how we show up is that's how we deliver. Correct?
Absolutely. Absolutely. When we talk about wellness, the irony I find in talking to doctors a lot of time, because I do this all day, every day. It's like recruiting. My boss always says, recruiting is not an 8 to 5 job. It is not. I'm working when my doctors are not working. So if that's 5 o'clock in the morning and they're on their commute in, or that's 9 o'clock at night and they're just getting off of the shift, or it's the middle of the day, it doesn't matter when. When doctors are available, that's when I'm recruiting, and that's not 8 to 5 a lot of times. But I think in that, what I hear a lot when I'm talking to doctors, I believe that it does match statistics that have been out, that post-pandemic, roughly 60% of doctors are reporting that they're feeling the burnout.
Wow.
From the 4 years that it took us, in particular those first couple of years, when we were heavy deep in COVID, doctors reported, like I said, over half of doctors reported that they were feeling the symptoms of burnout. They were feeling fatigued physically, mentally, emotionally. Some of it was from the extraordinary hours they were working. some of it from the overwhelming number of patients they were dealing with during the pandemic, and then just the mental fatigue and emotional fatigue that it took watching so many people be sick all at once and so many of them not surviving. That truly took a toll on our healthcare force. Nurses, doctors, physicians assistants, nurse practitioners, ancillary staff, occupational therapists, every single person that was involved in the healthcare industry is feeling the effects of it now, 4 years later, as we try to rebuild our healthcare force. When I talk to doctors, what I notice is a lot of them are tired still. And that's pushing them to make some changes. And I think so much of it has to do with what we already talked about: wellness, a desire to be well, a desire to have balance, that maybe wasn't always there or shifted after the pandemic. So those are some of the things that I'm seeing even as a recruiter when I talk to doctors. I've been doing this for a little over 3 years now, so not a real long time, but I started during the pandemic. And one of the things I will say is that we always tell our clients, okay, you have to dangle the carrot when you want to get a doctor to come to you, especially maybe in a less than preferable location or a rural location. When I talk to doctors, regardless of where they're at in their career, from somebody just starting out a fellowship and residency to somebody that's maybe more experienced in their career or midway through, money does not seem to be the driving factor as much as work-life balance and quality of life. And I am hearing that more and more when I ask a doctor, what do you want in this next position? And more often than not, many doctors are saying what they would like is better quality of life. And that can look a lot of different ways, depends on the doctor, and what their personal lifestyle is and what their personal situation is. But some of those things might be a more flexible schedule, less call, opportunities to have a little more time off. I will say we are getting away from the initially when I first started this, because we were in the throes of the pandemic. Many doctors were saying, we want telehealth. And we've kind of got to say, okay, telehealth is over, guys. That's not really, there are some positions that are telehealth, but more often than not, our doctors have been transitioning back to more traditional, that they're taking office, they're in the office now. So I think that is really important when we talk about health and overall wellness. Money is not always the driving force anymore.
Wow. That is quite interesting. That after the pandemic now, people are looking at life through a different lens. And what take precedent then and what the driving force was, it's not anymore because it become more essential. My family, my well-being, who I am is important. Money is necessary, money is important, but there are other factors that align with my values that I have to look at. And I'm hearing that that is what you're saying.
Yes, absolutely. One of the things that one of our vice presidents in our company, our vice president of marketing, he often says there are three buckets, and he's a former hospital CEO. So he knows a lot about, hospital staffs, recruiting, things like that, right? But he always says one of the things is that doctors have to look at their three buckets. And there's three P's: the professional bucket. So that's where your career's going. Your obviously the package, how much money you're getting, right? All of those things. But then the last bucket is the personal bucket, which is all of those things that we're talking about. So you might have two out of the three, pick the two that you want. But if that personal bucket is missing and the hospital has offered you a huge salary and a huge signing bonus and all of those things are great to get you in the door. But is it going to keep you there?
Right.
Doctors say coming out of training, so they're just out of residency or fellowship, they're just starting their career, right? They may or may not have a family. So sometimes those buckets look different depending on where you're at in your career versus a doctor that's got a young family and they're going to move their family halfway across the country to a city or a town that they've never even heard of before. That is a really big deal. Now, some of those things like the personal bucket is going to become huge and important because now you have considerations like where are my kids going to go to school? Is my family going to fit in there? What are our cultural values? Um, are we going to be able to, in particular, moving to a smaller, maybe more rural community? Um, are we going to be able to find the things that we want and need to support our families' enrichment within our culture? Then maybe that's schools that support our families' cultural and religious values. That can be nutrition. Are there stores for us to find the things that we like to cook for our family or
Right.
restaurants where we
Right.
can go and our family can enjoy an evening out? All of those things fit into that personal bucket. And that doesn't have a lot to do with how much you're getting in that package piece, how much money.
True.
So when I'm recruiting doctors, I really try to ask a lot of questions about all three. I don't just ask them, well, how much money do you want to make? Because that's only going to take us but so far. And I think it's really important, in particular, a provider who maybe isn't as established in their career or just coming out of training, have they really thought about some of those things? And this is an opportunity. My background is, and I may have said this on their last show, I was a teacher. So I'm constantly thinking about, you know, how do I need to help educate either the candidate, if they're at a place in their career where they may not be thinking about some things, or my client, the hospital, how can I help them learn more about the recruitment process on either end? Because that's part of our value added. I work with Pinnacle Health of Atlanta, and we really pride ourselves on we're not just recruiting for a client, we are adding value to the overall practice, whether that's through being a trusted consultant. I do the research, I tell them along with other people on my team. Um, I tell my client what's the market right now. Um, I inform them about, whether it's if they maybe want to hire a foreign trained candidate, what are some of the processes they might have to go through in order to help that candidate gain a waiver for citizenship here in the United States to continue to practice here. Some of those things become very critical in terms of recruitment for the hospital and for the candidate. So Pinnacle really tries to play all of those roles and wear those different hats. We don't just find you a candidate, drop them off at your doorstep and go, have fun. We're there throughout the entire process. And that's something that as a recruiter, I'm really proud of, that I'm involved with the whole process and not just, making a few phone calls to find somebody. I want this person to become part of the community, and I want them there for as long as their career will allow them to be.
Wow.
Wow. Congratulations for what you do. Go ahead, Karen.
Listening to you, Teona, it helps us to understand exactly what happens behind the scenes, because we may look at a doctor, we may be saying, oh, doctors make a lot of money. But as you explained to us just now, there are three buckets. You have the professional, the package, and the personal. And a lot of times, excuse me, the personal life is so on a strain. They have families, they have children, and there is not enough time being spent with these children. You know, Many times they miss a lot of time with these children, like children's school meeting and other impact in these children's lives. And I really like how you take the time to really ask the questions and the right questions to really get to know who you are recruiting. So you can able to say offhand, you know what? This person has a family, and now you can able to dive down into that personal bucket and to help them to understand how they can take care of themselves and do that work-life balance, because it is super important for all of us. We all of us have jobs, right? But how are we sustaining ourselves and balancing ourselves with these jobs that we have? And it is super important, especially when you have a family life. When you have a family life, you really got to know how to work around that family life. And it's a beautiful thing that you can take that time to really learn that candidate and have that relationship with that candidate. So you know what? They know they could always come to you and say, Tiona XYZ. And now you can see how you can help them or steer them in the right direction where they can get the help that they need, depending on what they are experiencing at that point in time. Congratulations.
Thank you so
Yeah.
much. Thank you, Karen. I appreciate that. When I started this job, like I said, it was during the pandemic, and some of it is very, it's a lot of volume, right? We have lots of jobs that we're trying to fill, and you have to talk to lots of people. I always joke, the little tag in my LinkedIn says the doc finder, right? And I learned very early on, I said, this is like dating. I said, it's like I'm trying to find the perfect match for the hospital. And I want them to meet. The hospital is going to court them. You know what I mean? But I got to find them. It's like, swipe left, as I'm going through these profiles. And sort of, do I want to swipe right? Whichever that is. I was a very bad online dater, so I don't remember if it was left or right. But as I'm going through profiles, I have to figure out, okay, who is this person on paper versus who are they really? And are they a good match for this hospital or for this practice? And is the hospital or practice a good match for them? The thing I don't ever want to do is send somebody off someplace and then they get there and they call and go, Teona, this is not what I expected. This is horrible. You have to find another job. That doesn't work for the candidate, nor does it work for the client, because now the client is in a bind. They've hired a doctor. One of the things people might not know is that recruiting a physician is an incredibly expensive endeavor for the practice. It costs a lot of money to recruit a doctor. So whenever we recruit a doctor, we want to make sure that that doctor is a good fit. Now, we can't do it every single time. Unfortunately, there are times where something doesn't match, something doesn't align. They are not a love match or a match made in heaven. And sometimes you don't find that out until the doctor starts, unfortunately. But we try to make those instances far and few in between. Because what I'm looking for is that perfect match for my client. And, they fall in love for a period of time and they live happily ever after, or at least happy for a long time. The doctors don't necessarily keep jobs, 20, 30 years or whatever the case is. But I do think that one of the very real impacts of the pandemic, again, going back to that really quickly, is that it created a huge doctor shortage. Those doctors that got burnt out. I will say that there were even doctors in the very beginning when I was recruiting. I talked to a doctor probably 2 years out, so maybe 2022, who, quite frankly, just kind of washed out. He was a resident and he did not finish residency. And he said when he got to the hospital where he was going to be doing his training, it was like first day of the pandemic. And he just said it was just too much. And unfortunately had a series of mental health challenges that presented themselves during this. And along with the medical director for the program that he was in said, this isn't the right thing for me. And then a couple of years later, he had decided, what, I really do want to be a doctor. And I will say that was a very difficult transition for that particular candidate because, unfortunately, illness and death are part of the job. And every doctor knows that going in. So for this particular candidate, it was hard. But he did find a job. I wasn't the person that placed him, but he did find a job. But I remember talking to him during that time. And he just said, this is not what I thought it was going to be when I decided at 12 I wanted to be a doctor. Nobody saw this coming. And I think that That's an extreme case of somebody that the burnout got to them very early on. But since, whether it's been for economic reasons, there are unfortunately many practices, in particular in rural communities throughout the United States, that have had to close their doors, or they've been absorbed by a much larger hospital system. And so the combination of doctor shortages, either from people leaving, retiring, just deciding this isn't what I want to do anymore, to hospitals not having enough providers to continue service because they don't make enough money, has left rural communities in very precarious situations. Um, and recruiting is like I said, a very big cost. The cost of the fee for a retained firm like the one that I work for, the cost of advertising or sourcing for the position, the cost of being without a doctor for a day in any specialty can be exorbitant, because when they're not taking patients, obviously they're not getting collections. And those are things that keep the hospitals going, right? So we're seeing so many of those dynamics. And as a recruiter, I think one of the things that I really look at that's very serious is, okay, this healthcare system is down 10 providers in whatever specialty, right? We have got to find doctors for them because their patients need to be seen. The waiting list may be longer than it normally would be because they're missing a provider, need more providers, or their provider is leaving for whatever reason. So I see the seriousness of what recruitment can bring to not just the hospital, but to the community, for the people who live in that community, to be able to get healthcare services that are much needed.
Wow. Describe rural versus urban.
That's a great question, Joan. So when we think about our rural communities, typically we're thinking about smaller populations of communities, and maybe they have like a critical access hospital, which is, sometimes like 25 beds, right? I'm in Atlanta, and we have rural communities throughout Georgia. Not every place is a big metropolitan center like Atlanta, but we have rural communities even just right outside of Metro Atlanta, Clayton County, Rockdale County, that are smaller communities. And for somebody who needs to receive healthcare services, maybe they're just, going to their primary care doctor. That's one thing. But what I often think about is I'm a cancer survivor. You guys know that. But for anybody who maybe wasn't on the show in the last couple of weeks or so, I'm a 9-year pancreatic cancer survivor. And
yeah,
I happen to live, yes, which kind of drove, we'll talk about that later, that kind of drove how I wound up in this particular capacity. But one of the very interesting things is that I happen to live in a large city, so that gave me great access. I had a choice of hospitals that I could go to receive oncology services and even have my surgery. For many families that I came to know, not being a recruiter, but as a cancer survivor that lived in the outskirts of Atlanta or just in a more rural community, one of their biggest challenges was accessing healthcare. They might be able to go to a local clinic to receive their oncology, but when it came time to get services like surgery, or if they had a medical emergency, if there isn't any place close by, you might be driving 20, 30, 40, 50 miles into a city the size of Atlanta to be able to go to a larger hospital system to get care. And that can be devastating on patient outcomes. So when we're thinking about rural communities, we are thinking about communities that are either a distance from a major metropolitan area. A lot of it is based on the population or the size of that town, and then how large their facility is. How many beds are there? Is it 25 beds, a critical access hospital? Or is it 400 or 500 beds? It more like a mid-size center. Or is it a very large healthcare system? A Mayo Clinic, a Cleveland Hospital here in Atlanta, Northside, Emory, Piedmont, all of those are very large hospital systems. And I will say that rural healthcare, there may be a perception that you are not going to get the best care. But I have actually been to a rural healthcare, not as a recruiter, but therefore to actually receive services and things like that. And there are wonderful, amazing, talented, knowledgeable doctors in small rural communities throughout America. There are options and technologies and things like that exist. We just have to tell doctors that rural healthcare has its advantages and it's necessary for those residents in that community.
Wow.
Thank you for explaining that.
Wow.
Like,
What are some of the strategies your company uses?
Sure. So when we're and I want to make sure I understand the question, Karen. When you say strategies, do you mean just as far as how do we find doctors?
Yes.
Okay. So we use a lot of Pinnacle actually does an incredible job of sourcing. And there are two types of candidates. We have active candidates, and those are people that are actively looking for a job, right? So residents and fellows who are getting ready to get out of their training program and they're going, oh man, I need a job, right? They're active. They're searching job boards. They're calling hospitals sometimes. They're going to career fairs. We have a lot of different entities out there. Career MD is one of the larger ones, and they host career fairs at different medical school campuses. That is something that we do as a company as well. We attend career fairs and we get in front of doctors and we try to meet them and we present opportunities to them that we have. We find out again what they want. Those are actually one of my favorites because it's one thing to kind of cold call a doctor, which is another strategy that we do use. We call doctors that we may not necessarily know and ask them or present to them some of the opportunities that we have. But I love being in front of doctors and getting to talk to them and having that initial engagement because then I get a feel for them and they get a feel for me.
right.
We do email, we do direct mail. We do a lot less direct mail now, but in the past we've done some, big direct mail pieces. Do less of that again because that's just does not tend to be the format that a lot of people are their go-to when they are looking for a job, right? We do lots of social media. This I will post to my LinkedIn so that doctors and things like that can find it. So
That's good. Thank you.
opportunity and letting me shamelessly plug Pinnacle Health. But we also think about candidates who are not actively looking for a job. So passive candidates, and these are our doctors that may be the doctors that have thought, I work a lot of hours. I work a lot of call. I've been in this location for a long time. I'm ready to advance my career, but I haven't really started looking yet, right? I'm ready to make more money. I'm ready to have less call. Whatever it is that this doctor is thinking, those are the doctors that we want to go after. And it was a real hard concept for me to understand at first. I thought, why are we going after people that don't want to move, right? There are doctors that are perfectly happy where they're at, and you could not get them to move for any reason. And we love those doctors because they are part of their communities and they are invaluable. And then there are doctors that sometimes if you offer them just the right thing, and you have no idea what they're looking for. Sometimes they don't know what they're looking for. But we come along through a series of advertising campaigns and we reach out to doctors everywhere and we present the opportunity. Sometimes that's an email, sometimes that's a text. Sometimes it's a LinkedIn or other social media post. I had a doctor on LinkedIn that said, hey, I saw an ad. We create advertisement. He says, I saw an ad. Can you call me about it? Those are the ways that we find doctors. And part of what we offer to our clients is that piece of we're not just looking for doctors that are actively looking. That's actually a very small piece of the provider population that's out there. There are more passive candidates that are sitting at home watching whatever they're watching tonight. And they're not thinking about a job. And I always say, you're never thinking about it until you do. And for our clients, sometimes those candidates who are not necessarily looking wind up being some of their greatest assets. They end up with highly experienced doctors, wonderful community members, and people who enhance the overall practice in the field of medicine. So we really do like to find those passive candidates.
Wow.
Wow.
Wow. That's truly amazing
Yes.
because you're really helping us to understand how this whole system works. You
Yeah.
know, we walk into office and we see a doctor, we sit down in front of a doctor, but you're taking us behind the scenes and helping us to understand how this whole thing is being run, you know? And it's amazing how when we can learn what's happening behind the scenes. Because we just see things but we don't know. And we take things for granted because we just see and we don't really know what's happening behind the scenes. Can you share some stories with us? And also, your company Pinnacle, you normally recruit people from overseas to come and work in the United States?
So the recruitment of foreign doctors is a little bit different. So we don't necessarily recruit overseas, but what we do recruit are people who are foreign trained graduates. And a lot of times they're already here and they're working on fellowship or residency, because the way it works in the United States, depending on the country of origin, most candidates are coming over on what's called, when they get a visa, right? And they're here on a work visa. So maybe they're in school, right? And they're finishing their training. But once they finish their training, they have to secure a job and apply for what's known as the visa waiver, or the J-1 visa waiver. And it's quite a long process. And I do really try to tell candidates who need the waiver, there are deadlines to apply for the waiver. Start looking quickly. Do not wait until the last few months of your residency to try to find a job. Um, the deadlines are typically much earlier in the year. So all of our residency programs here in the States end in June, July. I think it's like the end of June, or excuse me, the end of July. So everybody is finishing training at the exact same time here in the States. That means everybody's looking for a job. You
Right.
should start your job search about a year early, if not sooner, if you are going to need some kind of visa sponsorship from a hospital. And just a real quick note on that, one of the other pieces of that is there are only so many waivers available per state. There are multiple paths to take in order to, receive the visa, depending on lots of different things, right? But the most common way is through what's known as the Conrad 30, which is every single state, regardless of how big or small it is, here in the United States, gets 30 waivers. So California gets 30, Rhode Island gets 30. And some states do have a rolling deadline for that, but most states have a very definitive deadline for it. So all of these candidates that are here who are foreign trained and they're wanting and needing to get the waiver to stay in the States beyond their training, I highly recommend you get started early. Not every single practice, there's some rules around it. Not every practice can offer the waiver. But again, rural healthcare is an option to consider, because that is one of the ways for a practice to qualify to get the waiver, is if they're in an underserved community. So a small rural population that's underserved and doesn't have enough physicians can get this waiver. And that is a great way to start obtaining citizenship, or to go down the path for sponsorship for providers who are still in training. So we don't necessarily go and recruit intentionally outside of the country, but what we do is, when we have providers here who want to stay, if we have a client, and we do talk to our clients, and this is again part of that education piece, to say, can you offer a waiver? What position are you in? That is another expense and another cost to the practice. So they may not want to do that for a variety of different reasons, because it can be very costly. They have to hire an immigration attorney or retain an immigration attorney to be able to do all of the documentation, keep the candidate on track, make sure they don't miss deadlines, and that everything gets processed well. So the candidate can receive their waiver. So that's how we do that piece of it.
Wow. And my next question to you is that in the beginning, you discussed about doctors being burnt out,
Mhm.
emotional support they need, and all of these kind of stuff, is there a system set up that when these doctors are feeling this way, is there a system set up that they can go to get help, or they have to do it on their own personally?
That's a great question. And I think every practice is different. I think that a lot of that might depend on the hospital size, what the hospital values. Just as with most employers, there's a lot of employers offer EAP, Employee Assistance Program, that does within that. There are options for mental health services. So the irony that I have seen with a lot of doctors is even though they advise their patients stay healthy, right? Stay healthy, eat the right things, exercise, make sure you're taking care of your mental well-being. Sometimes I wonder, just from talking to my doctors, are they taking their own advice?
Right.
I would not be surprised if getting a doctor to take their own advice is one of the hardest things to do. And I am willing to bet their spouses, their families are telling them, hey, take care of yourselves.
Mhm.
And I wonder, are they doing it? But I think as far as your question goes, Karen, that is really individually up to
Sure.
the hospital. Now, I will say I have seen some wonderful, wonderful hospitals and practices that offer so much support to their employees. There's a hospital that I work with in Valdosta, and they have amazing employee assistance programs. They are always doing things for their employees, whether it's just in the course of a week or in actual programming that they offer to be able to assist employees. And then I've also seen some hospitals that have things. There's a wonderful little hospital in Blairsville, Georgia, and they actually have childcare services available for their employees, whether you're a doctor or just, somebody, maybe that works on the clerical side, nurses, all of them have access to, it's not right on site, but it's very close by in the community to make it a little bit easier.
That's great.
That's
Yeah.
beautiful. That's really, really beautiful.
Yeah. And seeing some wonderful things. I think, again, the pandemic has so much to do with how everybody's doing things now. We're so much more mindful, I
Right.
think, not just as individuals, but as companies and hospitals and just employers overall are putting a big emphasis on taking care of employees better. And I'm glad to see that.
Yeah, that's beautiful. That's really beautiful. And it's right how you said it's being more mindful because after the pandemic, there's a different concept of how we do things. We look at it through a different lens. How are we satisfying our employers, the employees, and everyone involved in the workforce so that we can try to understand how balance can really be achieved. Share some successful stories and cases.
Sure. There's one right offhand that I'm thinking of because this was probably one of my favorite people that I recruited. She is a radiation oncologist. And I can't quite remember how I came across her. Some kind of way I linked up with this very beautiful, lovely woman. She was up in the Northeast, and it was one of those, met her just at the right time, called her, talked to her just at the right time. And to make a very long story short, she says, well, where is the position? I said, well, it's in Southeast Georgia. And she had family ties to Atlanta. So she knew more or less where this particular community was.
Right.
And she said, okay, that's not too bad. And she had shared with me, I had shared with her that I'm a cancer survivor because I had said, thank you so much for the work you do. I'm a cancer survivor. And I know how important an oncologist is to survival of patients and improving patient outcomes. So the work that you do is incredibly important. So just thank you. That was like kind of how I started the conversation.
Right, right.
And in that, she shared with me and she says, well, my mother passed from cancer. And she said, and it's has not been that long. And she said, but I want to keep working and I want to save more people. And I said, okay. So that was like our first conversation. So time goes on. She kind of starts to get to know the practice a little bit. And I send her a link. And then she calls me one day and she says, Teona, what's the name of the cancer center? And I said, it's called the Perlman Center. And she goes, you're kidding, right? And I said, no, I'm not. Why? And she says, my mother's name was Pearl.
Wow.
You're kidding. And she said, I know because she was a little on the fence, and she said, I think I'm going in the right direction. So she comes down, they fly her out for the visit. And we had talked multiple times while she was on her visit. And the day that she was going to meet to kind of do the panel interview, she went to the cancer center to meet them. And then she literally called me and she said, she took a picture and then she called me and I said, okay, well, this is a picture of a bird. And she said, it's a red cardinal. That was my mother's favorite bird. And it's sitting in front of this hospital clinic as I'm going in for my interview. And I said, no way. And then she says, Teona, I just know this is the place. If they offer me the job, I'm taking it. They offered her the job. I very rarely get to meet in person the people that I recruit. But because she was so close, I actually went down one day and I actually had the chance to meet her, give her a hug. She was as lovely, if not more so in person than she was on the phone. And for me, that made me feel really good because sometimes in the day-to-day grind of trying to find doctors, because it can be a grind. I make 40 calls a day or send out 50 emails or 100 emails or whatever it is. I can forget that there are real people behind the screen that are doing what they do for any myriad of reasons. And she was one of those examples of somebody that just touched me so much. And I was just so glad for her. I was glad for the hospital, the practice. They love her. They absolutely love her. Her patients love her. And that made me feel really good. So that's the story that I think of right offhand was that particular doctor.
That's very fulfilling, though.
It really is. It can be because I think often with recruiting, you say that you kind of go in and you see this doctor there and they're doing whatever they do. They are people that have lives and ambitions and hopes and aspirations and families. And whatever they're doing, in the clinic or in the OR or wherever they're at practicing, they are a whole person. And I think about how much these doctors bring to the community. Many times, our doctors, especially in smaller communities, can play huge roles. When you're in a small community, everybody kind of knows everybody. But when I've gone to rural communities for visits, the doctors are there, seeing, their patients when they go to their child's ballet recital or football games or whatever they go to, or they go to the PTA meetings, or they're just part of the community. They, go there and they get their coffee in the morning and they see their patients and they play these huge roles. They are friends, neighbors, consultants, advisors, members of the community. And that's really important when we think about healthcare because I think their overall job is to create better outcomes for communities. And whatever their specialty is, that really plays a big role in the overall health and wellness of that community, wherever it is, big or small.
Right. How do we reduce the burden?
Joan, we can't hear you. We're not hearing you.
How do we reduce the burden? You said my mic is on. I don't know what happened.
Yes, we're hearing you now. Yes.
I can hear you.
Yeah.
How do we reduce the burden? For doctors in burnout or a lack of doctors in the community?
You could do it both ways. Tell us both.
Yeah, I think as far as the burden that comes to doctors in terms of burnout, like I said, I think hospitals are being monumentally more mindful of things they have to do. I think things like training our nurses, and this is going on to become nurse practitioners and PAs, actually releases the burden of one of the biggest components of burnout, which is call. Doctors having to take call is huge in terms of burnout. So by teaching those skills to other people in the healthcare industry, that actually reduces the burden of doctors because now they're not working clinic and taking call in the middle of the night 5, 6, 7 days a week. I have heard some crazy call schedules. I have one doctor that I'm working with right now, and he's like, I go to call like almost every day. I'm like, how do you do it? We got to get you a new job, So I think that is one thing that's actually underway, and that really helps. I think in terms of recruitment, I think that hospitals and practices are honestly going to have to be monumentally more thoughtful about the fact that doctors are wanting better quality of life. And I think they're also going to have to think outside of the box. I
Right.
think another thing that we haven't really talked about tonight is ageism within the healthcare field and how
Wow.
it plays out in recruiting. We see it in every industry. Um, Doctors are working longer. My pediatrician was my children's pediatrician, right? And it did not bother me one bit. I loved this doctor. He was like the best thing since sliced bread to me. And I was thrilled when I had children 25 years later that could go see him. But sometimes there's a perspective within the healthcare field that whether it's the patient perspective or the practice perspective, I don't know. I see it on both ends that older doctors have lost their value. And I think a shift in mindset around the fact that older doctors or more mature doctors can have a vast positive impact on the healthcare industry beyond what they've already had. They bring with them knowledge and expertise. They also bring with them the ability to recruit doctors who are earlier in their career, because a lot of things that I hear new trainees or newly trained doctors coming out, they say, I need a mentor. I want to
Mhm.
learn my skill set better.
Right.
I don't
Right.
want to be on my own. I'm not ready to run a practice all by myself. So I think that we are really overlooking how much these highly experienced, more matured providers can still bring to the field. They've already brought so much over the course of their career, but they still have a lot of knowledge that they can continue to help us grow within the healthcare industry. And then not only that, I think one of the other pieces that becomes very critical is that economically, I hear many providers say, I'm at 55, I'm at 60, I'm at whatever. I can't financially afford to retire for a multitude of reasons.
Right.
Post pandemic, again, a lot of things have changed economically, and doctors are feeling that, and they're prolonging their careers, and they're healthier too. I think that now, we hear all the time, we joke around, okay, 50 is the new 40 or 30 or whatever it
Right.
is that people
Right.
see. But when I do talk to doctors that have maintained their health, I recruited a doctor very recently who is over 60. The guy like runs, I don't know how many miles a day. I mean, like
Oh,
he is a very active gentleman who really has taken care of his health so that he can work because he loves his profession. He loves his specialty and he wants to continue working. He said, I can do this for 20 more years as long as I take care of my health. So I
yeah.
think that those things will release some of the burden overall.
Okay.
Wow. That's
Wow.
truly amazing,
Wow.
because it it shows us that one thing can result in something else, and it bring more awareness about life and understanding oneself on a deeper level, which is absolutely great. My last question to you is what advice you can give to the healthcare system at this point in time?
Ooh, that's a big question. Take care of your doctors.
Mm,
Take care of your doctors.
yeah.
We all desperately need well trained, well rested,
Good.
stable,
Yes.
um, balanced providers. The healthcare industry, if the pandemic taught us nothing else, it taught us that health is a luxury, and we are all impacted by the burdens of a lack of health and wellness. So I think I would tell hospitals, take care of your doctors, however that looks. Provide, compensate them well, absolutely, but also provide them with the things they need to be successful: mentorship, technology, enough time off to recover, staff, mid level staff that can help take on some of those burdens that we talked about. Advanced practice providers like nurse practitioners and physician assistants, all of those things help a provider provide the best care possible for their patient, and everybody reaps the benefits of that, including the hospital.
Well done. Well done.
You
Well
serve
done,
well.
Tiana. You served us well. You
Okay.
served us really well.
I hope so.
And as I said before, is that you help us to understand behind the scenes because we just see things on the front line, but we don't know what's happening at the back.
Mm.
And you bring clarity to help us to understand exactly the role of a physician and all the other healthcare workers, what they are facing, and things that need to change in order that they can function at a high level and also with their personal life that they can function at home as well. So you bring clarity this evening, and we just want to thank you so much for coming into this space and sharing your wisdom with us because a doctor can look at this podcast and said I can relate to what she is talking about, you know, or a nurse could look at this podcast and say I can relate to what she's talking about. So thank you for bringing that clarity for us. We are so honored to have you here, and we appreciate you always saying yes and coming and showing up for us. Thank you so much.
Thank
Joan?
Well, what a night, what a space, what an enlightenment, what everything. You have totally expanded our toolbox. You expanded our container. You help us to understand the three buckets and what that entails. You help us to understand rural and urban burnout, what it looks like, and after the pandemic, how doctors felt in those moments. So you give us a whole list of how we should look at the role of one who recruits doctors. And you're doing a fantastic job, an amazing job. And thank you for sharing the story about that individual that you work with and how you give her the level of guidance and how you supported her. Because I think with any job that somebody's trying to recruit or trying to get into a job, encouragement is so important. Understanding what the values are of the company and you bridging that gap and you are able to help people to understand what is expected of you, and then you could ask them what they are looking for, and then you know what their needs are. So then you, as you rightfully describe it, it's like a match because it got to be a right fit, is so that they can be productivity and they can be a level of value that everybody wins at the end.
Mhm.
So you're doing an amazing job. We are so appreciative of you coming and enlighten us and give us a real great insight and new perspective of how this because we are seeing it on the outside, but what it takes to really put all of this together so that a hospital can function and a doctor can function when he or she accepted the role to move into that space and to help their patient to have a quality life and that they can have a quality life, how they can balance out work and their lifestyle and what they should look forward to so that they can achieve happiness for themselves personally. So it's been so beautiful and so amazing of everything you do and everything you share with us. So we're grateful. Gratitude.
Yeah, yeah, we are truly grateful to you, though. Truly great. And we are so proud of you.
Yeah, we are.
We're
Thank
so
you so
proud
much.
of you. Yeah,
Fantastic.
because listening to you, it can give another woman hope
Hmm.
to know that, you know what, maybe she thinking about doing something with her life.
Hmm.
But looking at you explaining the beauty of what you're doing, she can step up and say, you know what, I can do this.
Right.
So it's all about empowerment. It's just empowering, empowering all the time. Beautiful, beautiful. And as Joan was wrapping up there, one thing that came to mind is that one thing we all can do whenever we go into a doctor's office, the question that we should ask him, how are you doing today?
Hmm.
I love that. Yeah.
Yeah.
You know, anytime we enter our doctor's office, one question we should ask them, because they normally would ask us, but we should ask them, how are
Right.
you doing today?
Beautiful.
Because now we totally understand what happens
Yeah.
behind the scene. They may come out with a smile, but you never know what's happening with them, you
Right.
know. So we can approach them and we can ask them, how are you doing today? So
Mm-hmm.
let this be
Yeah.
a sentence that we can ask them whenever we meet them, how are you doing today? And it's not even we have to be in an office. If you know a doctor and you run into him in a supermarket or you run into her in the supermarket, just stop and say, how are you doing today?
Mm-hmm.
You know, just that kind gesture
Nice touch.
would mean so much to them that
Mhm.
someone cares. How are you
Absolutely.
doing today?
And you notice.
Exactly,
You know.
exactly. You want to thank you once
Thank
again.
you.
And to the audience, we want to thank you so much again for staying up, because some people it's all across the world from the UK and they're still up and
Yeah.
joining us. And you know what? We really appreciate each and
Yeah.
every one of you for staying up. And don't forget to subscribe to Soul, Light, and Body, because you will never miss none of these episodes, because this space here is just to enrich you. We always bring on a guest to enrich you, the audience, and to bring you to that level of awareness to understand different subject matters on a very, very deep level. So thanks again for joining us, Tiona. Thank you so much for
Thank
your
you so
time.
much.
Thank you so
You
much.
both. Thank
Bye bye.
you. You're
All
always a
right.
joy and a pleasure. Thank you for
Yeah.
investing in my
Thank you.
life. Everybody
Thank
have a great
you.
night.
You too. Have a great night.